there's a general perception out there that fruit is somehow equal to sugar and is therefore bad for us. You were telling us, tell that story that you were telling me about the community center.
Yeah, I will tell you, the listeners, about an interesting conversation I had the other night, and what you said, Kylie, just now about nourishment. It's all of these healthy foods and carbohydrates that we are absorbing, all this great nutrition from, vitamins and minerals and all the things that power our body. What's healthy for diabetes is healthy for the whole system. What's healthy for the whole system is healthy for diabetes. Diabetes has been treated singularly with this horrible phrase, I'm putting it in quotes, is the diabetic diet, which is such a bad word. And still seeing that there's a prescription for us, for people with diabetes, that we're supposed to follow, as if we're just going to fix the diabetes part and make it look like your glucose isn't moving, but everything else could potentially suffer, like the heart, like the cardiovascular system, like the kidneys, mental health. And there's evidence of that going on because we're not treating the whole system. Historically, right? We have evidence of doing exactly the opposite clinically than what clearly the Mastering Diabetes recommendations are, really help to treat the whole body. And certainly there's flexibility within that. But yes, so with that said, interestingly enough, at a community center here where I teach indoor cycling classes, we had this great idea to do Blue Zone showings because they have a theater. And so of course we pull up Netflix and we're just going to show them. So one of four, it's been really great. There's been a range of different types of people that have come, a range of ages. So they all have different reasons for wanting to see it. And we pitched it as, hey, you'll get to have a little discussion with me afterwards. I was going to present, here's what we're going to Costa Rica today. We're going to learn a little bit about Greece. We're going to head over to Loma Linda today and learn these things. And then we'll talk about anything we saw that was really powerful and meaningful to us. What was so beautiful is we were demonstrating a blue zone in the moment as we were together in a community. As we were, people were sitting in partnership with each other. We were creating friendships. And in fact, I saw someone there who I have not seen since before COVID in 2019. I had not seen her, and I did not know she was a member of the community center. And she came walking in at the end of the showing and just, Lauren, I was like, oh my God, Janet. And I just adore her. And she's a woman of so many hobbies. Yeah, just so many hobbies, and keeps herself busy and super active and all these things. And then she came to my cycling class the next day. And it's just been a very super delightful experience to do this with a community of people. And last night was the fourth one. So we wanted to give everybody some fruit. And, I would have just had a big bowl sitting there with apples and bananas in it or something. And they actually had a really nice display and they brought cut up fruit. Yeah. And they had hummus out and waters and all these things for people. And there was a really great couple at the end who was fun conversation. So I stayed a little bit later to talk to them. And they had said something about, now, is all this fruit okay for blood sugar? Because we've kind of heard that maybe it's not so great. And another employee that was there that was helping me to host the Blue Zones had said, oh yeah, we've all heard our doctors say that maybe we shouldn't eat fruit because it'll raise our blood sugar. So we spent a few minutes talking about that little delightful spread of misinformation about the fruits. And I'm able to, look at all the colors here. And these colors all represent different nutrients and plant sterols and stanols and antioxidants and things that are doing things at the cellular level that is going to support more functioning than just blood sugar. So in fact, being told that fruit or greens or beans or whole grains or anything that we've all been told, and also there's been some awful book written about to slam them, we all can sit here and say it's absolute nonsense to be afraid of the foods that grow from the earth, that provide the most cancer-fighting, disease-fighting, nutritional value than anything else. So anyway, if we sound a little passionate today about carbohydrates, it's because we are.
Yeah, we totally are. And it's so you're giving us a little snapshot into this like beautiful experience you were having with this at the community center. And you're right. I love that you made the analogy that you were creating your own little blue zone because, and if anybody listening hasn't heard or seen the read the book, The Blue Zone Diet. The blue zones are areas of the world where they have the longest living populations of people. And part of the reason for that is they have many things in common. These zones have many things in common. And one of the things is community, sense of community. Another is regular activity. Another thing is that they have very plant strong, if not plant dominant, if not plant only diets, right? What are the two others? Like I'm blanking on the other two.
There's so many. I mean,
yeah, there's like many
so many.
features. Yeah.
Yeah. The faith-based, also purpose-based,
That's right. Driven and
purpose-based. And
in that, and so there's a documentary, it's like just recently released documentary on Netflix. So like check it out. It's definitely a wonderful. And I think it's really cool that your community center is offering this to show the power of community. Like how fitting. What a great place to show that. And here was this simple conversation and there was the fear right there, the fear of fruit. And it's such a common experience. We hear from so many people who start with us. And the reality is that, and maybe you kind of remember back in the days when you first started noticing, when you were first making this transition, that in the presence of a high fat diet and with insulin resistance underlying your body, fruit can cause more glucose variability for sure. We know that that is true in those initial kind of days. But one of the cool things is that as you make that shift to a low fat environment or low fat dietary intake, then the carbohydrates don't have the same influence on your glucose, right? So as you're shifting, it's almost like you're shifting from one end of the spectrum to the other, from the high fat to the low fat. And there can be a lot of noise in between that, right? There can be a lot of noise as your body's adjusting to the increased fiber intake, as it's adjusting to the carbohydrate intake. That shift can create some noise, which is where I think the fear really starts to come up, because all of a sudden, oh, well, I ate that fruit and my blood glucose started going all over. I started getting higher readings than I've seen before. And this is just too scary. I can't continue. And we've seen and heard our own clients, our own members of our community have those same feelings. And so if we're going to talk about where the fear comes from, I think that unfortunately there is an experience of elevation in those initial, as that shift is happening. I don't know if you remember experiencing that yourself, or, if you've seen that even with some of your own clients, or.
It's two different things. It's always being focused on the short term. That is also something that there's goods and bads when it comes to focusing on the short term, being present, thinking one meal at a time, one insulin sensitizing meal at a time, 1 hour of exercise at a time. Those are the beautiful ways to look at the short term healthy habits that you can do that will accumulate into the reversal of insulin resistance that we're looking for, or the anti-inflammatory effect that we're looking for, or the weight loss that we're looking for. So in those daily habits is where we get what we want. But then there's also the adjustment phase that happens. And if we're really fixated on our glucose values, when in the moment where we're still eating high fat foods, or we're coming off of years of low carbing ourselves, yeah, there's going to be a little bit of maybe 3 steps forward, 1 step back, but that's the learning process. And I think that I started to realize how little I ate fruit. I think that was the first thing. I often talk to clients about just take inventory of what you are eating, maybe in animal products. No judgment. Let's just look at it all. How often do you throw sour cream on your taco? How much are you putting yogurt on stuff? How much cheese are you sprinkling here, there, and everywhere? Just take assessment. And then we'll focus on the foods that you're not eating. They're in the plant world that are insulin sensitizing. So we can start to fill you full of fiber, while at the same time, just think about pulling back on the things that were high fat. So that one step at a time kind of a way to go can be the best way to start shifting our perception with trust in the numbers, with trust in the predictability of what's going to happen, because it is not easy to exit that low carb world when you've been there for a really long time and you're still scrolling through Instagram and listening to a doctor that doubts you. How many of us, I can tell you, I'm going to speak on the behalf of the coaches, is how many of us work with clients that are rocking it. Like their A1Cs are dropping. They feel good. They're sustaining something that they enjoy. They don't feel like they're dieting. They're really getting a hang of things. But they go to their clinical appointments and their A1C has dropped again, let's say, or it's maintaining at a really healthy space. And their doctor says, I get what you're doing, but maybe you should think about eating more fish. Maybe you should think about the protein. They're still getting it, even though they are like perfect examples of the research that is in the thousands of pages at this point.
Yeah.
Come on, doc. Come on.
Right. Well, I mean, and yeah, I know it's so frustrating to hear that happening. Cause then, again, exactly to your point about the doubt, right? Then all of a sudden they're getting doubted. And as soon as those seeds of doubt start to get planted by somebody that we trust, by somebody that we have looked to as a medical advisor, as a health and wellness or medical advisor, when they're planting a seed of doubt in your mind, of course, it can start to unravel the work that you've already done up to this point. And so to your, like these clients that have already gotten this far, they've started making these changes that are so life sustaining, so life preserving, and adding these nutrient rich foods, and they're becoming healthier. They're losing the weight that they've been trying to lose, or their A1Cs and their cholesterol levels are starting to normalize and getting into healthy ranges. And they're getting doubted by their trusted provider. And it's just so frustrating. And that's where another element of that, it's a little different than fear. I think it's that all of a sudden it starts to, can create some anxiety of like, am I doing the right thing? It's almost like a little bit of existentialism, right? Like, well, what am I doing? Am I supposed to be doing this? My doctor's saying this is not a good idea. So, that is a very real experience. And yeah, I'm glad you brought that up because it's a source of the fear too.